I am Flavia Bellieni Zimmermann from the Australian Institute of International Affairs in Western Australia, and today we have with us Sara David. Sara David is the founder and CEO of Living Child Incorporated, a charity aimed at reducing maternal and newborn mortality rates in Papa New Guinea. Today we will be discussing Making the World of a Difference, Grassroots International Development from Perth to Papa New Guinea. Thank you for being with us, Sara.
Thanks, it's a pleasure.
Sara, in your opinion, what are the main challenges faced by women and young children in Papua New Guinea today?
Well, Papua New Guinea has a diverse population, and the geography of the country is really diverse. So it's a lot of water, a lot of very, very thick jungle, and then very steep mountains. And up to 90% of the population lives in those rural areas. There's very little infrastructure, so roads are they're not good roads if they are there. So women and children, so most of them are living in villages where there's no power, there's no running water, access to health services, to proper education is just non-existent at the moment. And certainly in the area where Living Child is working in the East Sepik province, that is a huge challenge. So it's access to services. That is one of the biggest challenges.
Thank you very much. And Sara, can you share with us what are the main initiatives on the ground that can change the living conditions of women and children in Papua New Guinea and address the lack of infrastructure, the lack of roads and access to water?
I think one of the first things is to actually engage with women on the ground and in those really remote areas. So in my experience, a lot of organisations and even the government are not even going to those places. I've had government people say, oh, you're going to areas where we don't even go. So the first thing is to actually engage with these people and to find out what are their issues. And I also think that it's really important that when you engage with those people, that you listen to what they say. So again, a lot of these women, since the 80s, so those are the ones who are doing most of the childbearing at the moment, they have not had any formal education beyond about a grade 3. But they are bright women and they know what is happening in their communities. And so going out there, speaking to these women, finding out what their issues are, and then working with them to address those issues as they have identified them. Because I think then you engage them, you gain their trust and their respect, and they will be willing to work with you. And of course, when you're engaging with the woman, you cannot forget the men, because Papua New Guinea is still a paternalistic society. The men are the gatekeepers, so you cannot forget the men. You need to engage them as well in a respectful way.
Thank you very much. And Sara, can you share with us how international development can work side by side with these communities to listen the needs of the women on the ground and promote social change?
From my experience and a lot of conversations that I've had, and especially with the bigger NGOs and bigger organisations and the government, is, like I said, that they are not engaging with people in those remote areas. 90% of the population lives in the rural, remote areas. So the way that we've operated is that we have gone out to those areas and engaged with those people. And I really think that that is the way that this has to happen. My experience, and in the East Sepik province, for a number of years, the government was just non-functioning in that province. So there was no governance, there was no supervision of services, so nothing was happening. And because of that, a lot of the NGOs pulled out their services, but the population in the main town is a very, very small representative of the whole province. So the rest of the province suffered just because of a lack of governance by the government. And I think that's really sad. And again, so what we did as Living Child is that we engaged with the remote communities, and it was through the churches. The churches are very strong in these remote areas. So because we had an invitation from the church, it gave us permission to be there and authority to be there. And I think that that's really important, that NGOs work with who are the respected leaders in those remote areas. For us, it was the church groups, so we've worked in there. They've provided safe passage, they've provided all the right invitations, they've provided the authority, because you need to have authority to be in those areas. So again, it's about not neglecting those really remote areas and remote people where majority of the population lives.
Thank you very much, Sarah, for sharing the work that is being done in Papua New Guinea. And wrapping up our interview, if you could share with us when Living Child is engaging with communities in Papua New Guinea, exactly which sort of services or which sort of work that they're actually doing.
So that Living Child is doing?
Yes.
Okay, so we were invited by the churches, and our the specific request was, well, in fact, this was before Living Child even existed. So I, as a midwife, was invited to this area by the churches because the male leaders recognised that the women were dying in childbirth, and so many mothers were dying, it was affecting the whole communities and structure of the communities. So I went in initially just to do training for the village birth attendants. That's what they asked for. And I remember that at that first interaction with the community, when I started to talk about water and hygiene, they didn't want to know about it. Okay? But what I've seen is that so then of course when I came back to Australia, there were no other NGOs in the area, so I started Living Child. And then we've continued to go back and do training. But what I've seen is that as the community, as they've grown in confidence with the training and the teaching that we've given them, they've put it into practice, they're seeing that it works, they have been coming back to us for more and more. And one of the things that I've noticed is that I think it was 5 years after our first engagement with them, they then started to ask for water and sanitation. And even just this year, they are now starting to ask for nutrition. And so I think that that's the way that Living Child operates. And I think you've got to go slowly, and you do what they ask of you, and you also work within your scope of practice. So something that's really important for Living Child and the vision of Living Child is that we're focused on family health for mothers and babies, but the family unit. When they start talking about water and sanitation, we start talking to other people. We can do a little bit of training around water and sanitation, but we recognise that we need to get other people in to do that who are experts in that area. So it's working within your scope of practice so that you can continue to be really effective according to what the community needs are.
Thank you very much. Pleasure talking to you.
Thanks, Flavia.
Thank you for being with us. And for more information, please visit our website www.internationalaffairs.org.au. Thank you.